Hello, I'm Dr. Marla Shapiro, and I have the pleasure of being on the Board of Trustees of the International Menopause Society. With me today, I'm joined by Dr. Rossella Nappi. She is a professor of obstetrics and gynecology at the University of Pavia in Italy, director of gynecological endocrinology, IVF, and menopause research. And today, she's going to help us navigate and understand headache and migraines as women transition through the changes in life, perimenopause, and menopause. So, for a woman in her late 40s, 50s, transitioning, hormonal fluctuations, what happens with headaches?
Headaches are very common during menopausal transition. It can be just an headache, so a tension type pain that is just deriving from stress or tension, and this headache is part of the climacteric syndrome because some women they are suffering from symptoms and therefore maybe they don't sleep well, they feel fatigue, they are moody, and this is really stressful for them. They work a lot, they have plenty of things to do, and they develop an headache. This is something very common. But for some women, uh, the situation is even worse because they suffer from migraine. Migraine is a different kind of pain, is a very severe pain, pulsating. Sometimes you have nausea and vomiting. You don't like the light or the sound around you. And this is very severe with a strong impact on quality of life and well-being, working productivity, taking care of your family. And for this reason, we should inform always women that unfortunately, around the time of menopause, especially during the transition, since we have many more hormonal fluctuation, if you are suffering from migraine will get worse and will really be a problem in your life.
So, as the sex hormones are fluctuating, as you mentioned, in and around the change, and then leading to a decrease in the sex hormones, what impact and role do they have in promoting migraine or headache?
They have a major role because we know that when these hormones they are not very well balanced, so it's not just a question that the hormone is too high or is too low. It's just a question between balance between estrogen and progesterone. We know that the brain is very sensitive to that. The pain threshold of women is significantly affected. This is particularly evident also when women they suffer from menstrual irregularities because they have maybe heavy menstrual bleeding, they have pain. So keep in mind that also heavy menstrual bleeding is inducing pain because you have a lot of inflammation during the menstruation, and therefore migraine is very severe and it become extremely severe to and resistant to painkiller, both the one we use the on the on over the counter, so meaning simple painkiller, but also specific anti migraine agents such as triptans. So women they should talk to their healthcare provider to try to figure out how they can stabilize hormones. Sometimes they do by using hormonal contraception. Sometimes they can do by using hormone therapy during the perimenopausal years. But of course, they should pay attention to the type of product they are using because it's very important to keep in mind that migraine can pose you at risk of developing hypertension and other cardiovascular risk factor that may harm your future life in terms of cardiovascular and cerebrovascular risk.
So, if we as a woman are a migraine sufferer, and we are having hot flashes and night sweats, and we're in the menopause transition or in the menopause, is it possible to use hormone therapy to control the hot flashes, and what impact will it have on the headaches?
It's possible, but we really need to be a little bit more careful. So we should discuss with our healthcare provider the type of hormones, the dose of hormones, because of course these women, if they take maybe too high dose and they have also other risk factors such as they are overweight, they have already hypertension, they may be a little bit at higher risk of stroke, particularly if they are suffering from migraine with aura. And women, they know where the aura is. It's like having some stars in front of their vision, blurred vision. They may suffer from this. And this is a phenomenon that really need to make an alert, and you should discuss immediately with your healthcare provider. So there is hope for every woman with migraine that can take hormones, but they really need to be informed that if some side effects are occurring, they should refer to the healthcare provider.
Well, I think that's really important for information for women to know that it doesn't necessarily preclude it, but that hormone fluctuation may make it worse. And that's something that does give you the impetus to seek healthcare to talk about co managing the headaches, the perimenopausal transition, and then on through menopause.
I see a lot of women, they have a lot of benefit from hormone therapy if you start really during the transition. And then when they enter the menopause, maybe you can switch to different treatment. For example, you can use a treatment during the transition that is still giving you the bleeding, the regular bleeding, and then you can switch to treatment that will help not to bleed anymore, and in this way you will stabilize even better your fluctuation. You will use a little dose of estrogen, little dose of progesterone, and women that will feel better, and they will cope not only with the symptom, but they will cope with many other aspects of their life, improving really the well-being. And so there is always hope. You can use a treatment as soon as you discuss with your healthcare provider.
Thank you so much for joining us today.
Thank you, Marla. It's a pleasure to be with you.